And you go by a virus hunter, kind of unofficially, correct?
Yes, that's the unofficial term. I'm on the virus hunter team.
I love that so much. Can you tell me just a little bit about what that entails and what a virus hunter does?
A virus hunter is someone who watches viruses to keep an eye on them because they're constantly moving and changing and mutating. And we know that they can do this at any moment. So we can never let our guard down. We have to be faster and we have to work together with partners around the world to keep an eye on them. So Abbott's been a leader in this kind of work for decades. We've actually been hunting viruses going back to the 90s when we first started checking all the mutations that HIV was accumulating to make sure the diagnostic tests would continue to detect all the strains that were circulating. And so since then, we've continued to do this work, looking at things like hepatitis viruses and now, of course, SARS-CoV-2 or COVID and the flu, which are constantly changing.
So I know this probably COVID played a huge role in your life, I'm sure, in recent years. But I'd love to know, as things have sort of progressed since, what are some of the trends that you've been seeing kind of out there as a virus hunter right now?
Well, I think we've continued to see COVID evolving, and that's to be expected, actually. As people's immune responses develop to one strain, the virus is motivated to change so it can escape from those immune responses. And that's what we're seeing today. We're certainly keeping an eye on those changes so that we can make sure that tests are working and that sequences are out there to update the vaccines to be able to keep pace with those changes that happen in the virus. But from what we're seeing circulating today, the growing predominant strain for COVID is XEC, which is something we're keeping an eye on. But we also know that from what the WHO analysis has shown is that this is a low risk to the public. It's not particularly more dangerous than other COVID strains, but it is changing, so we need to keep an eye on it.
Do you also have to look at symptoms? Because I know certain variants kind of had different symptoms associated with them so far. So are you noticing any changes in the symptoms as some of these kind of subvariants start to rise?
That is something we look at, and so far we're not seeing any difference in disease severity or in symptoms. But that's how Omicron was first discovered, actually. Our partner that we work with in South Africa noticed that amongst a group of people in an area that had already recently had a COVID wave, suddenly they were having more severe symptoms. And that alerted him that we needed to sequence those samples to see what strain was present. And fast forward, after he got those sequence data back, he alerted the WHO that this was a new variant of concern. And that was when Omicron was first named.
Wow, that's so fascinating. So you're not seeing anything as of right now with XEC that kind of alerted you to being like a little more concerning than any previous variants or anything different like that.
So far, no. In fact, we expect the latest updates to the vaccine to protect people from severe outcomes the same way that the previous excuse me versions excuse me have also caused been able to prevent more severe outcomes from the strain that's currently circulating. It's kind of like how the flu has been in the past, where mutations that allow it to spread every season are the ones that we're combating with vaccines.
That's wonderful. Is there anything, outside of COVID that you are tracking at the moment or keeping an eye on? I know there've been, a number of bird flu outbreaks or norovirus, things like that. Anything that you're seeing out there right now?
Yeah, so we're monitoring globally. So that's something to keep in mind too. Well, it's really important to know what's going on in the United States. We have the Abbott Pandemic Defense Coalition that's actively monitoring disease trends around the world at over 20 sites on 5 continents. And so we certainly have been keeping an eye on H5N1, which is avian influenza, in particular in the US, because we're seeing more and more human cases lately. These are primarily in people who are at risk because they're interacting with livestock. And livestock are currently the reservoir, the place that you're most likely to find avian influenza, as you'd expect, because it's a virus that primarily affects animals and birds. But that could always change, and so that's why we have to keep an eye on it. As people get cases, they've been mild, which is good news, but that could always change. We've learned one thing through COVID, and that is that we can't assume anything. So it's really important to have an active view and proactively be looking at how these viruses are changing so that we can respond. We know that every outbreak is different, and it's really important that we're all staying as healthy as possible so that we can be prepared for whatever's coming next.
That's so true. If I learned anything during COVID, it's you're never going to be able to predict everything. Um, but with that, do you see anything on the horizon as you're kind of looking globally at the viruses that are circulating? Anything that kind of question like what could be the next COVID, or is there something that could be the next COVID?
We all would love to know what is coming next. I think that question comes from the similar place that I have, where I want to know so that I can be prepared, as prepared as possible, at least. Um, and so what we've actually realized is that no single person will be right. Of course, we can't individually predict what's coming next. But at Abbott, we took the approach of actually doing a survey recently this year of over 100 infectious disease specialists around the world to get their take collectively as a group to see what they thought might be coming next. And the good news is that the majority of the experts felt that we are better prepared or as prepared. Um, than we were to manage COVID for a new pandemic that could be coming or any new outbreaks. But there were some gaps that were identified by those groups. And so those are things that we're working on addressing. The first one is in our surveillance efforts. So even just being able to look and see what's changing and mutating, which is what we've been talking about so far today, we need to expand our efforts there so that if something does emerge, we're on it immediately. The second is to know what we're looking for, which could be changing as the climate changes and as we see new things like new places where bird flu can be found. That's just one example of, we can't assume anything. We have to be looking at everything holistically. And then we also need to understand how different types of symptoms might alert us to different types of pathogens that could be emerging. For example, we're starting to see dengue is an infection that's spread by mosquitoes in parts of the US, in Texas, California, and Florida. And that's a virus that has acute fever and can kind of resemble some other things if you don't know what to look for. So knowing that we should be looking for these kinds of things is really important, so that people can get the appropriate care if they do come down with any of these illnesses.
That is, I'm just so intrigued by all of this. I think this is so fascinating. Um, so when you're kind of taking stock of what's at least maybe just in the US right now, what would you say is the biggest virus of concern, and then kind of, down from there?
Well, I think in the United States we can't necessarily rank which one is the scariest per se, but we need to really be prepared for everything that's circulating, especially the respiratory pathogens, because we're in the sort of respiratory season where things like RSV, flu, COVID, and even strep throat are spreading in some places more than others. And as we have holiday travel coming up, that could change. Hotspots can then become the entire country potentially, that are seeing spikes in all of these different respiratory pathogens. So the thing that we need to be aware of is that the best way to prevent the spread of all of these respiratory pathogens is with diagnostic testing. We certainly saw this at the beginning with COVID, and we're seeing it every respiratory season, that the sooner people get tested, the better their outcomes, and so they can be healthier and get in touch with their healthcare provider to get appropriate care and treatment if it's needed, but also so we can prevent the spread to others who might be more vulnerable to having more severe outcomes. And so we have home tests available, like Abbott's Buy Next Now test. You can also get tested for a lot of these different pathogens at a pharmacy or at a clinic with a rapid ID Now test from Abbott that will give you an answer within 15 minutes so that you can take the next steps to make sure that your family is healthy and your community.
Awesome. I think those are really like my main questions. I would love if you're able to Um, Specifically because we've been seeing kind of an increase in people searching for things around COVID. I'm assuming because of the holiday gatherings and things like that. If you're able to talk just a little bit about what you're seeing with XCC in terms of um, what are the symptoms people can watch for, and then how soon should they test, and just kind of those things that you're talking about of like what can they do if they start to notice even minor symptoms that maybe they wouldn't necessarily be like, oh gosh, I have COVID, something like that.
The symptoms to keep an eye out for, particularly if you're concerned you may have been exposed to COVID, would be the usual symptoms that we're seeing in past waves. So, something like a fever or a cough or a very sore throat. Those are the early warning signs that someone should get a test or check to see if they have COVID. But the thing is, a lot of these other pathogens have the same initial symptoms. So it's really hard to tell if someone might have COVID versus flu just based on symptoms alone. So you kind of have to check in with your healthcare provider to see what they would recommend. But obviously, testing is going to give you the definitive answer so that you'll know whether or not your family has COVID or flu, which all kind of start with the same fever, sore throat, runny nose. And a test is really key in those kinds of situations.
Is it still good to test multiple times just in case you maybe like aren't quite there yet for your first test and it doesn't detect it on the first try, or is that really not as much of a thing now?
Well, the home tests like Abbott's Buy Next Now are really intended to catch infections when people are at their most contagious. So when then they have the highest levels of the virus present. So that means that if you're still feeling sick after a negative test, it would make sense to check in with your healthcare provider and possibly do another round of testing.
Perfect. Well, I think that's it for me. Is there anything that you would like to add? Anything on, what it's like being a virus hunter, or anything along those lines?
Well, every day is different as a virus hunter, and that's kind of what's exciting to me is to see what's coming and how we can help. As a mom, I want to make sure that we have a healthy world for all of our children, and everything we can do, whether it's from washing hands to hunting viruses, all makes a difference in keeping our communities safe.